So I'm an internal medicine physician. When I was in medical school, I worked so hard to get into medical school. I was very underwhelmed by the medical system, realizing that modern medicine doesn't really aim to heal people. It just aims to keep them sick, keep them dependent on medications, keep them dependent on the system, just so you can maximize the profit that you make off them. And it was really a very hard time for me in medical school because you know everything I've wanted throughout my life was to become a doctor, and all of a sudden I realized that we don't really help people. And it was a hard time for me. I thought about quitting many times. Maybe I should just go learn on my own. What's the point of studying medicine if all I'm doing is just pushing toxic pills on people? But I decided to stick to it. I thought having the credential will be helpful in the long run. And I now kind of on my own studied the things that actually help people get better. And I try and help people heal themselves that way rather than through pills and medications.
At what point did you understand what was your training and so forth is not doing any help? And also, what percent of your training, or generally speaking, the medical school training, is false?
It's hard to say what percentage it is, but the entire premise is built on something wrong. So it could be up to 100% of what we're taught is wrong. The physiology of the body that we're taught, okay, makes sense, but then the principle of things can be fixed by giving a pill, that is just completely false. The entire premise of Western allopathic medicine is that there is some sort of abnormality in signaling in the body, and if you introduce a pill to address that abnormal signaling, you can heal that condition. Well, the abnormal signaling is just a mechanism for the body to to indicate that there is an issue somewhere. Like your joints hurt, the issue is not the pain that you're feeling. The issue is that there's inflammation in the joints, and the pain is a signal for you to do something about it. Or if you have bad back posture, your back hurts, the disease is not the pain. The pain is just an indicator to you that your posture is wrong and you need to fix that. But what medicine does is that it examines that and sees that there's an abnormal pathway in the back or in the knees that's causing this pain. And if we give a medication that just numbs that pain, then that's considered a cure. But in reality, you haven't really done anything to address the root cause.
Yeah.